My first question is, why can a person survive with one lungs, yet damage to a small area of the lung can become life-threatening? So this is a question. I expect you to think and answer this question and drop it in the comment section below. So we're going to start with the anatomy of the lungs. So we're going to make you understand the basic and the concepts of structures and organs that are found in the body. So at the end of this lecture, students should be able to know the answer of this question. Not only that, you're going to be able to define lungs, describe the external features of the lung, explain surfaces, borders and lobes of the lung, describe bronchopulmonary segments of the lung, explain hilum and roots of the lungs, explain and describe the blood supply, nerve supply and lymphatic drainage, which is the lympho-neurovascular structures of the lung, explain pleura and pleural cavity, relate anatomy of the lungs to clinical condition, learn how to write a full mark MBBS anatomy answer on lungs. So I'm going to teach you all these things, so make sure you just take a cup of coffee and relax. So let's dive in straight to the points. So this is how we are going to write on the anatomy of the lungs. So first, I'm going to write the definition. After writing the definition or definition stroke introduction, you go over to the location and extent, go over to the external features, surface and borders, lobes and features. Then after this, and these are all the structures and microscopic of anatomy, you now move over to the functions and clinical aspects. So before you move over to the clinical aspects, you start with the hilum and roots, the blood supply, the nerve supply, the lymphatic drainage. Microscopic anatomy is also another aspect of studying anatomy using microscope. So I'm going to treat this as a separate topic in my next lecture. So then we now move over to applied anatomy. So let's start. What's the definition and introduction of anatomy? So first, what is the lungs? The lungs is the primary paired organs of respiratory system. I want you to take note of something. We said it is the primary. It is primary. Means, so when you're talking about the main organ of respiratory system, you know there are so many things that consist the respiratory system. So when you're talking about what is the main thing that is composed in the respiratory system, is the what? Is the lungs. It is paired organ. The word paired means two. They are not one. They are two. Paired organ of the respiratory system. So their primary function is gas exchange. So what is lung doing? Lungs is where gas exchange occur. Which particular area of the lungs? The alveoli. This is where oxygen from the atmosphere diffuse into the blood and carbon dioxide diffuse out of the blood into the atmosphere. So let's talk about the location of the lungs. The lung is situated within the thoracic cavity on either side of the central mediastinum. Now, some people will now start asking, what is mediastinum? And mediastinum is just a space which is bounded anteriorly by the sternum and laterally by the lungs and posteriorly by the thoracic vertebrae. So the mediastinum just contains the heart. So it's a space that contains the heart that is bounded laterally by the lungs. So this is where the lungs are located, within the thoracic cavity on either side of the central mediastinum. So this is the region of the mediastinum, and the lungs is lateral to this mediastinum. They are lateral to the mediastinum. So this is where the lungs is located in the what? In the thoracic cavity. So what is the anatomical extent? Apex. The apex. So when we talk about the apex of the lungs, look at the apex of the lung. This is what we mean by the apex of the lungs. So it extends into the roots of the neck. So the apex extends. We are talking about the anatomical extension. So the apex extends into the roots of the neck, reaching slightly above the level of the sternal end of the first rib. So the apex of the lung is 2 to 3 centimeters above the clavicle and the first rib. So after the clavicle, so when you measure 2 to 3 centimeters, you now see the apex of the lung, which move in and out during respiration. So the base is broad, concave. Now, I want to explain something to you. When we say something is concave, now let's just imagine this diagram now, this C-shaped structure. So if I say something is concave, means that I'm viewing it from this dimension. So concave, I'm viewing it from this dimension. If I say something is convex, it means I'm viewing it from this direction. Concave from this direction, convex from this direction. So don't confuse that. And from now, you now know the difference between concave and convex. Now, when we said the base of the lungs is concave, so if you think concave, as I said earlier, is in this dimension, you see it? It is a concave shape at the base, concave, which rests on the convex diaphragm. Remember, concave is from this dimension and convex is from this dimension. So when we said it rests on the convex diaphragm, now take a look at the diaphragm, and when I view it from this direction, when I say it is what? Convex. The concave of the lungs rests on the convex surface of the diaphragm, or you can just say the base of the lung is broad and it rests on the surface of the diaphragm. So it's all accepted. Now let's talk about the external features of the lung. So when we talk about the external features of the lung, the base, the apex, the borders, and the surfaces are involved. So let's start with the borders. First, there are 3 borders that are actually considered when we are talking about the lungs, which are the anterior, the posterior, and the inferior borders. So the anterior border is thin, sharp edge where costal and medial surface meets. Now, just take a look at the anterior border. So this is the anterior border. This region here is the anterior border. This region here is the anterior border of the lungs. So they said is where the mediastinal surface and the costal surface meets. Okay, and the mediastinal surface is this region, the surface facing the heart. The surface of the lungs facing the heart is called the mediastinal surface, and the costal surface is the surface facing the thoracic cage, which is the ribs and the sternum. So the mediastinal surface and the costal surface meets at a point. That point where they meet, or that edge where they meet, is called the anterior border of the lungs. So the posterior border is broad, rounded, but it is a broad rounded border resting beside the vertebral column. So this posterior border is resting on the vertebral column. You know, we have 12 thoracic vertebrae. So this 12 thoracic vertebra, the posterior border of the lungs is resting in the vertebral column, which is the thorax. And the inferior edge, or the inferior border, is a sharp edge which rests on the diaphragmatic base, on the diaphragmatic surface. So look at the inferior border. This is the inferior border. The inferior border rests on the what? On the diaphragm. So as I said, we have 3 surfaces. These are the costal surface, the mediastinal surface, and the base, or the diaphragmatic surface. So the costal surface is convex, extensive outer surface pressing against the ribs and the intercostal surface. So just have it in mind that the costal surface is the surface which is facing the sternum and the ribs. That's just the costal surface. The surface of the lungs, which is this anterior surface, you can see as the costal surface, facing the sternum and the ribs, is what's called the costal surface. While the mediastinal surface is the surface facing the heart, because the mediastinal surface contains the heart. It's like a space which contains the heart. So the part of the lung, or the surfaces of the lung facing the heart, is called the mediastinal surface, and it makes a cardiac impression on the left side of the both on the left side and the right side of the lungs. And remember, the left side of the lungs have cardiac notch. We're going to describe that when we are talking about the differences between the right and the left lungs. So the diaphragmatic surface, we always know, is broad, concave, inferior surface resting directly on the diaphragm. Just have it in mind that the diaphragmatic surface is the surface of the lungs resting on the diaphragm. And we have the right and the left lungs. So here, or this particular section, we are going to like describe the difference between the right and the left lungs. Now let's start with the feature. What are features of lungs? So features of lungs are lines, grooves. Features of lungs are grooves that are present, or grooves that divides the lungs into lobes. So when you hear the word features just mean grooves. Grooves are depressions that divides the lung into lobes. So we have features in the right lungs and we have features in the left lung. Now, for the right lung, we have two features, which are the horizontal features and the oblique features. The horizontal feature and the oblique feature. Now, in the left lung, we only have one feature, which is the oblique feature. And these features are grooves that divides the lung into lobes. Therefore, we now have lobes of the right and the left lungs. So the lobes of the right lungs are three, which are the superior, the inferior, and the middle lobes. Now take a look at the superior or the upper lobe, the lower lobe, and the middle lobe. Now these are features. These features divides the lung into lobes. So these lobes for the right, there are three, which are the superior or the upper lobe, the middle lobe, and the inferior lobe. And for the left, it is only one features, and this feature now divide the left lung into superior lobe or upper lobe and lower lobe or inferior lobe. Just have it in mind that features divides the lungs into lobes. So for the weight, the right lungs is more heavier than the left lung. Just have that in mind. It varies in individuals. So but have it in mind that the right one is more heavier than the left lungs. So let's talk about the dimensions. So when we talk about the dimensions of the lungs, we are trying to explain the size and the measurement of the lungs. So the right lungs is shorter and wider. Now if you take a good observation of the lungs, you see that this right one is shorter and it is what? Wider. It is wider when you view a lungs in very, very standard anatomical textbook, such as Gray's Anatomy textbook. You observe that the lungs is shorter. The right one is shorter and heavier, wider, while the left one is just longer and narrower. Narrow means thin. It is narrower, while the left lung is longer than the right lungs. So we have the cardiac notch. The cardiac notch is absent in right lungs but present in left lungs. So what is cardiac notch? Cardiac notch are deep indentation on the anterior border of the lungs. So what are indentation on the anterior border of the lung? We're talking about impressions. Now take a look at the cardiac notch. We said it is absent for the right lung. So the cardiac notch is not present in the right lungs, but it is present in the left lung. Look at the cardiac notch. It is an indentation in the anterior border. Indentation we're talking about there is the impression. It's the heart makes an impression on the left side of the heart. So there is an impression. That impression on the anterior border of the left lung is called the cardiac notch. Let's talk about the lungula. The lungula is absent in right lungs but is present in what? In left lung. So the lungula is a tongue-like projection from the superior lobe or the upper lobe. Now, this is not where the lungula is. Look at where the lungula is. It is from the what? Superior lobe or the upper lobe, and this is the lingula. It's like a tongue-like projection, as you can see there, and this lingula is absent in the right lungs but present in the what? In the left lung. Don't forget that lingula is present in the left lung. It is like a tongue-like projection from the superior lobe, and it is at this junction. So we have the mediastinal impressions. When we're talking about the mediastinal impression, we're talking about structures located in the mediastinum that makes an impression. What are the structures that are found in the lungs? The structures that are related to the lungs. We're talking about impressions. They leave a mark. They leave a mark in the lungs. That's impressions. That's what we're talking about. The mediastinal impressions, structures that are found in the mediastinum. We have the azygous vein, we have the superior vena cava, and we have the esophagus for the right lungs. And for the left lungs, we have the aortic arch and the descending aorta. So these are just the few things you should just know about the lungs. So let's talk about the helium and the roots of the lungs. So when you hear the word helium, what comes into your mind? So helium is where lympho-neurovascular structures enter and exist the lungs. So helium is just like a doorway in the mediastinal surface. Mediastinal surface is the surface of the lung facing the heart. So the surface of the lungs facing the heart has a helium. That helium is just like a doorway where lympho-neurovascular structure enter and exist the heart. You hear the word lympho-neurovascular structures, we are just talking about the lymphatics, which is lympho, neuro, the nerve, vascular, blood supply, and just structures. So this is where blood supply, lymphatics, nerves enters and leave the lungs, and also airway. These are like the helium is just provide. It's just like a doorway where structures enters and leave the lungs. Just have that is just the main thing you have to just know about the helium. So we have the right lung and the left lung, and this right lung, the artery is anterior to the bronchus. Now look at the pulmonary artery. This is the pulmonary artery, and look at the bronchus. So for the right lungs, and this is the right lungs. So for the right lungs, the pulmonary artery is anterior. Look at it. It is anterior to the bronchus. While for the left lung, it is superior to the bronchus. Now look at the bronchus and look at the pulmonary artery. The pulmonary artery is superior to the bronchus for the left lung, and is anterior to the bronchus for the right lungs. Don't forget that. Regardless of the side, the two pulmonary veins are always positioned in anterior-inferiorly. That means in front and below. So the two pulmonary veins is always anterior, in front of the lungs, and inferior. Now look at the two pulmonary veins. Look at this. Both of them are always anterior to the bronchus and always inferior to the what? To the bronchus. That is all we have about the helium and roots of the lungs. Here is a question I want to ask you. Why do the right lungs aspirate than the what? The left lung? Let's talk about the bronchi tree, which is the airway architecture. So what tell us? The bronchi tree is just trying to explain how these airway structures subdivide or branches into the lungs. So we have airway structures. So what are these airway structures? These airway structures are structures which are responsible for taking in oxygen, carbon dioxide in and out of the lungs, and they are lined by epithelial cells, and they also moisten the air, and bronchi tree performs so many functions. But when you hear the word bronchi tree in gross anatomy, it's just trying to explain how these airway structures branches into the lungs. So the first one is the tracheae, and look at the tracheae, this long pipe here, which are made up of cartilage. Tracheal cartilage, ring cartilaginous structures are called the tracheae. So this tracheae branches into left and right main bronchi, or the bronchus. They branch into left and right bronchi. So the junction or the ring cartilage where this tracheae branch into left and right bronchi is called the carina. So there is a ring structure, cartilaginous ring structure, which we call the carina, where this trachea reaches and branches into left and right bronchi. And this region is where, when the epiglottis fails to close during swallowing and food particles are found in this junction or in this region, guess what? The patients or the subject in victim starts coughing. So that moment when you are coughing because you were eating is due to the food particles have entered this region, the carina, where the tracheae branches into left and right bronchi. So when these food particles enter this carina, that is when we have coughing. That is where you start coughing. So we have, from the bronchi, we now have the lobar bronchi. So what are the lobar bronchi? You see, the trachea branches into left and right bronchi, then they now branches into what? Lobar bronchi. So what are lobar bronchi? This lobar bronchi, remember that the lungs have lobes. So lobar bronchi is just how this bronchi branches to supply the lobes. So when this bronchi further divide to supply the lobes, we call it what? Lobar bronchi. And remember, the right lungs have 3 lobes due to they have 2 features, and the left lungs have 1 lobe, have 2 lobes due to they have only 1 feature. And due to this reason, we now have 3 lobar bronchi on the right lungs and 2 lobar bronchi on the left lungs. And the next thing we now have is now the segmental bronchi. The first one is the tracheae, the second one is the bronchi, the third one is the lobar bronchi, and the fourth one is the segmental bronchi. Now, these lobes divide into segments, whereby the lobes have different segments. So these different segments of the lobe is supplied by segmental bronchi. Don't worry, I'm going to explain this further in the next seconds to come. So we have the structural support of the lungs, which are the tracheal rings. Look at the rings, these rings here, these cartilaginous rings are the tracheal rings, and keep the airway open. That's a function. The distal bronchus lacks cartilage and rely on smooth muscles. Now I want you to make a deep observation. If you take a look at these lungs or the bronchi tree, you see these ring-like structures called the ring cartilage, and they are just present both in the tracheae, the bronchi. But for the bronchiolus, look at the bronchiolus, which are the segmental bronchi. There is no cartilage there. So meaning that this cartilage function due to what? The muscles, the smooth muscles supplying them. That is just the main thing I want you to understand here. So let's talk about the clinical correlations. But these clinical correlations, I just want to add it here because I want you to understand something. But normally, once you want to add clinical correlation is the last thing you're expected to write when writing or when preparing for anatomy exam. So the right main bronchi is wider, shorter, and more vertical than the left. Because of this architectural difference, Inhaled foreign bodies are highly likely to aspirate into the right lungs. Now, let's explain something. What is aspiration, or what is when something is aspirate? We are talking about to take in. So when we aspirate, mean that we are taking in, we are sucking in. So here is a question I want to ask you. Why do the right lungs aspirate than the what? The left lung? The reason is the right lungs or the right bronchi is more shorter, more wider, and more vertical. So food, as we said, that induces coughing when it is present in the carina can be aspirated by the what? By the right lungs, due to it is wider, it is more vertical, and it is more shorter. So particles find here, or foreign bodies find here, tends to move towards the right side than the left side. So that is what that is just trying to explain. Let's talk about the bronchopulmonary segments. So when you hear the word bronchopulmonary segments, what is in your mind? Pulmonary segment is just trying to explain the subdivisions of the lobes. Remember, the lung have lobes, and these lobes is subdivided. So the process by which we subdivide the lobes is called the bronchopulmonary segments. So the right lung have 10 segments, meaning that each lobes, the right lungs have 3 lobes, while the left lungs has 2 lobes. And these right lungs, when you subdivide these lobes, we now have segments. And how many segments are present? 10 segments for the right, while for the left is what? 8 to 10 segments. So let's define the bronchopulmonary segment. Let's just further explain it. It is an independent structural and functional unit of the lung, separated by the connective septa. When you hear the word septa, it's just a wall that is separating the lobes. Or septa is just, their main function is just to separate. That's just, they are like connective tissues, or they're like tissues or layers. Their main function is just what separates. So they are independent structural and functional units of the lungs. That's what bronchopulmonary segments. Why do we say they are independent structural and functional units of the lungs? Because each lobe subdivides into segments, and these segments are further supplied by what we call the segmental bronchi. Don't forget that they are supplied by the segmental bronchi and by the pulmonary arteries and veins. Now, each segment is supplied independently by its own segmental bronchus and tertiary branch of pulmonary artery. So just have it in mind that each segment is supplied by what? Pulmonary artery and what? Bronchus, tertiary bronchus or segmental bronchus. And right lungs have 10 segments, while the left lungs has 8 to 10 segments. So why do we divide this lobe into bronchopulmonary segments? Why? It's due to what? The surgical anatomy of the lungs. Remember our first question. We can survive with one lungs, but we cannot survive when one part of the lungs is affected. It's due to this reason, the bronchopulmonary segment. So I'm about to answer the question. Due to when part of the lung is affected, it can be surgically removed. That is called segmentotomy. It's called the surgical removal of the bronchopulmonary segments. Just have that in mind, that we can remove part of the segments of the lobes. Why? When they are affected, it can be caused by cancers, it can be caused by tumors, it can be caused by fluid in the pleural cavity, it can be caused by so many things. So we can remove one part or the segment of the lobe and still survive, because they are independent. They are independently supplied by pulmonary artery and segmental bronchi, and they are independent structural and functional units of the lungs. That's why we can survive with one lungs, but we cannot survive with part of the lungs affected unless it is what? Surgically removed. Don't forget that. So let's talk about the blood supply. So the blood supply is a dual circulation. So when we mean something is dual, it is what? Two. And from the right ventricle. So this right ventricle constructs. As it constructs, it sends or takes this blood to the pulmonary trunk. Now from the pulmonary trunk, this pulmonary trunk splits into right and left pulmonary atria or artery. This artery now supplies the corresponding right and left lungs. So the blood supply is the pulmonary arteries, and what is draining this blood is the pulmonary veins. So this pulmonary artery supplies deoxygenated blood to the lungs. And remember, pulmonary artery is the only artery in the body that supplies or carries deoxygenated blood away from the heart. Anything arteries carries oxygenated blood, but for the pulmonary arteries, it carries deoxygenated blood to the lungs. Why? Because it is there, it is oxygenated in the alveolar capillaries. Don't forget that. And the pulmonary veins is the only vein that return oxygenated blood back to the heart. And where does it return it to? To the left atrium, which is now taken to the ventricle and then taken to the aorta. Then it is now circulated all over the body. So just have something in mind. The blood supply is done by the what? Pulmonary arteries, which supplies the lungs, and what drains the lungs? The pulmonary vein. So what are the nutrient circulation? So how do we circulate nutrients? So nutrients is circulated through the systematic circulation. Systematic circulation is just all about the circulation of blood throughout the body from the left ventricle to the aorta. Then it's not circulated throughout the body. So brachial arteries supplies the structural lungs tissue. So what is supplying them? The brachial arteries. They supply nutrients to the lungs in order to maintain the tissue. So branch directly from the aorta. So the bronchial arteries branch directly from the aorta. These high pressure vessels supply oxygenated blood and essential nutrients to the brachial tissues of the lungs. The brachial tissues of the lungs are just the structural tissues of the lungs and the airways. So that is what you have in mind. So let's talk about the lymphatic drainage and the nerve supply. So the lymphatic drainage and the nerve supply. So let's start with the lymphatic drainage. So the lymphatic drainage is the superficial plexus. Now take a look at the superficial plexus. The superficial plexus drains the visceral pleural. So what are the visceral pleural? The visceral pleural are just layers lining the lungs. So there are layers lining the lungs, which are the parietal pleural and the visceral pleural. So the parietal pleural just lines the thoracic cavity, while the visceral pleural is not the one that is lining the lungs directly. The one that makes this surface contact with the lungs is the visceral pleural. They're just layers that is lining the lungs. Just put that in mind. Layers lining the lungs are the pleural. So this pleural is further divided into visceral pleural and parietal pleural. Now the space between them is now called the pleural cavity. I'm going to explain that in the next few seconds to come. We have the superficial plexus, which drains the visceral pleural to the what? Lung parenchyma. So look at the superficial plexus. It now drains it to the lung parenchyma. Now from the lung parenchyma, we now have the deep lymphatic plexus, which now drains it to the pulmonary vessels. And from here, we now drains it to the what? Tracheobronchial nodes. So this is how the lymphatic drainage of the lungs works. So we have the nerve supply. So the nerve supply is the sympathetic nerve supply and the parasympathetic nerve supply. So the sympathetic nerve supply, the parasympathetic nerve supply originates from the vagus nerve. From the what? The cranial nerve. The vagus nerve comes from the cranial nerve. Don't forget that. And the parasympathetic nerve, what is the main function? Vasodilation of the pulmonary vessels. So what is vasodilation of the pulmonary vessels? The vasodilation of the pulmonary vessels means the relaxation of the pulmonary vessels is what we call vasodilation of the pulmonary vessels. Relaxation of the pulmonary vessels. And which nerve is doing that? Which nerve supply is doing that? The parasympathetic. From what? From the vagus nerve. Why the sympathetic? What is the main function of the sympathetic? Vasoconstriction. of the pulmonary vessels. The vasoconstriction, what is vasoconstriction? Contraction or the constriction of the blood vessels is what we call vasoconstriction. And what again does this sympathetic nerve do? Bronchodilation. So bronchodilation means what? Expansion or realization of the what? Bronchis. And for the parasympathetic is doing what? Bronchoconstriction, which is what? It is constricting the what? The bronchus or the bronchi or the bronchioles. Let's talk about the pleural cavity and the alveolar histology. But we're talking about the gross anatomy of the lungs. So we are not going to measure our energy in this alveolar histology. So maybe next time or when I'm teaching on the histology of the lungs, we are going to now talk about the alveolar histology of the lungs. But for now, we're talking about the gross anatomy of the lungs. So I'm going to focus on the lungs, the parts of the lungs we can see, the pleural and the pleural cavities. So what are the pleural? As I have said before, the pleural are just layer lining the lungs. That is the simplest definition you can define the pleural as. The pleural are just layer lining the lungs. And in this pleural, we have the visceral pleural and we have the parietal pleural. So the parietal pleural just line the inner thoracic wall, the diaphragm, and the mediastinum. That is the parietal pleural doing that. Why the visceral pleural? The visceral pleural is not the one that is lining the lungs directly. So this pleural is further divided into two, which are the visceral pleural and the parietal pleural. The parietal pleural lines the inner thoracic wall, the diaphragm, and the mediastinum. Remember, the mediastinum contains the heart. Why the visceral pleural is not the one lining the lungs directly. And the space between this visceral pleural and the parietal pleural is called the pleural cavity, and it contains fluid. And these fluid are formed by the pleural layers, and this pleural layers produces this fluid, and this fluid is called the pleural fluid. Remember, the pleural layers lining the lungs divided into visceral pleural and the parietal pleural. Now the space between this visceral pleural and the parietal pleural is called the pleural cavity, and this pleural cavity contains fluid called the what? The pleural fluid. So we have the recesses. Recesses are space where, just have it in mind that recesses are space. So this pleural cavity, these pleurals changes their surfaces. Like they move from the costal surface to the diaphragmatic surface and to the mediastinal surface. So that region, that space whereby the pleural moves from one surface or changes from one surface to another is called the pleural recesses. And we have the costodiaphragmatic recess and the costomediastinal recess. So what is costodiaphragmatic recess? So we have the costal surface and we have the pleural surface. So the border, which is usually the inferior border, where the costal surface of the pleural changes to the diaphragmatic surface. So that space there is called the costodiaphragmatic recess. So the same thing to the costomediastinal recess. The costomediastinal recess is the space whereby is where the pleural changes from the costal surface to the mediastinal surface. So the space which is usually in the anterior border is called the costomediastinal recesses. Don't forget that. And it also contains fluid. And this recesses allows the borders of the lungs to move in and out during respiration. Just the alveoli is just what you have to have in mind is the alveolar histology is where gaseous exchange occurs. So we have type 1 pneumocytes and we have type 2 pneumocytes. So type 1 pneumocytes is just where gas exchange occurs. Why type 2 pneumocytes produces what? The surfactants. That is just the little thing I'm going to tell you about the alveolar microanatomy. So when I start teaching the histology of the lung, we now dive deeper. So let's talk about the applied anatomy. So in the applied anatomy, we have the pneumothorax, we have the pleural effusion, and What is pneumothorax? Pneumothorax is also called the pneumonia. And I know you have heard of the disease called the pneumonia. It's also called what? The pneumothorax. And what is pneumothorax? Pneumothorax is when there is air in the pleural cavity. Remember, the pleural cavity is the space between the parietal pleural and the visceral pleural. So when there is air in that region, we now call it what? Pneumothorax. We now call it pneumothorax. So we have the pleural effusion. So what is pleural effusion? Pleural effusion means when there is excessively accumulation of fluid in the pleural space on the pleural cavity. Now look at the pleural effusion. So there should be little amounts of fluid, but when there is excess accumulation of fluid, we now call it what? Pleural effusion. So here are possible questions you should expect in viva. So why is the right lung more prone to aspiration? The right main bronchus is wider, shorter, and more vertical. That's the answer to the question. That's the answer to the question. Because the right lungs we said is shorter, wider, and any foreign particles that is found in that region where the trachea divides into right and left bronchi usually moves to the right due to its anatomical position and its structure. So what is bronchopulmonary segment? I've always said, just have it in mind, bronchopulmonary segment is just how the lobes are further divided, and they are independent and functional units supplied by the tertiary bronchus and the atria. Before we go, we also have what we call the lingula. The lingula is on the left part of the lung, and this lingula is like a tongue-like projection in the left part of the lung, and its main function, or just have it in mind that it is below the cardiac notch. So the lingula is just like a tongue-like projection which is below the cardiac notch. Don't forget to like, subscribe, and hit the notification bell for more videos like this on Sagacious Learners. See you next time.